Hi, Elizabeth Krupinski here from Emory University, the Arizona Telemedicine Program, and the Southwest Telehealth Resource Center. I'd like to talk to you about the development and role of telemedicine competencies. I have nothing to disclose. Why is all this important? Well, as everyone knows, telehealth has been around for actually quite a while, well over 30 years. And if you really want to go back, well over 50 years in some form or another. But the modern era really is, say, in the past 15 to 20 years. And during COVID, it just really took off. And all of a sudden, telehealth, telemedicine was like the buzzword in the way that patients were able to get their care. This is just one example. This is U.S. counties in the United States, those that are supported in their healthcare via our Medicare, our federal program. This is the percent of primary care visits that were done via telehealth only in the month of April 2020. And it shows the percent of patients. And as you can see, I mean, obviously based on population density, and how COVID was affecting the different regions, everybody had different experiences. But as you can see, in some areas of the country, especially on the east and west coasts, there were counties that basically had anywhere between 81 and 100% of primary care visits taking place via telemedicine. Very, very few places, if any, had 0 to 20%. The vast majority of primary care visits, at least, were in the 21% and above range. So it obviously took off, and there's a lot of people still using it since COVID is still on. Well, what do patients think about telemedicine? This was a recent survey done by doctor.com. And the results are actually very interesting. What they found was 50% of the people surveyed had a telemedicine visit in the past 3 months. When they asked the people who said no, why? Well, 50% basically had no reason to see their doctor, which makes a lot of sense. 32% had financial concerns. Would it be reimbursed, for example? And 18% had some technical challenges. When asked about whether they would likely use telemedicine after COVID, 83% said they were likely to do so. Now, when people are asked, what do they like telemedicine to be called? Because as you know, there's a lot of terms out there. 24% preferred telemedicine, 21% a virtual visit, 18% preferred telehealth, 16% virtual care, 12% remote visit, and only 10% telecare. So it seems most people are going to prefer telemedicine, telehealth, or a virtual visit. It's just a marketing thing, but it's something to keep in mind. Now, how would people prefer to get their telemedicine? Well, not surprisingly, 68% said they would prefer to use their mobile phones. Whether or not that's the best tool, that's up to debate, but I mean, that's what people would prefer. 48% preferred their laptop, 28% a tablet device, and only 17% wanted to use their desktop computers. Now, 74% would want to use telemedicine, but they would prefer to do it with a doctor they already have a relationship with. If they don't have a relationship, only 55% would want to use telemedicine with a doctor or a provider that they've never met before. Now, if they had to see a new doctor, 40% said it would be acceptable if they had a referral to that doctor, for example, from their primary care physician, or, and this surprises me, or maybe not, I don't know, the doctor has great online reviews and star ratings. So I guess if you're good at telemedicine and you get a 5-star rating, you might get customers, but if you only get 3 stars, your patients might not want to see you if you're their new doctor. Make of it what you want. Now, if people had to cancel an appointment due to COVID, how would they want to resume care once the COVID pandemic is over? Well, 57% said they would prefer to just go back to having an in-person visit. However, 35% would want treatment via telemedicine. 6% simply said they can't resume and would not probably be able to resume after COVID due to financial reasons, and 2% had some other reasons. Interestingly, 93% would likely use telemedicine for prescription management. It's just a lot easier. And 91% agree that telemedicine would help with appointment and prescription adherence. Interesting. So, and a lot of data that we have suggests that a lot of this is absolutely true. Now, what types of conditions would patients seek via telemedicine? A lot of it is sort of the major things that, people are concerned about. Allergy, ears, nose, and throat, common cold, basically, and allergies. 45% would actually use it for a routine preventive visit, and 45% would use it for mental behavioral health counseling or therapy. As you can see, there's a lot of other scattered results there: COVID testing, GI, pain management, arthritis, dermatology, and so on. But the percents do go down a little bit. What factors would help in making a telemedicine appointment? Well, one is if the technology is easy to use. And this is critically important. If it's too hard to use, the patient can't figure it out, they're not going to want to do it. 57%, basically some sort of communication, advertising, marketing, whatever, that telemedicine services are available. Another survey that I saw, people were asked, well, why didn't you consider telemedicine? The answer was they simply did not know that it was available. Kind of silly. If it's there, but people don't know about it, what good does it do? 47% would want online scheduling options. Again, make it easy for the patients. And 47% want it, and they want it now. So it needs to have immediate availability, which is closer to reality with telemedicine than it is an in-person visit. Other things, understanding how your insurance works, making sure it's secure and private. And again, this one is kind of interesting. This one here, reading reviews from other patients about their experience. I think people just don't know what's going on. So hearing from others about what they expect, getting those 5-star ratings is enough to convince people that it's a viable option. It's interesting. So if all of this is true, that patients want it, that it's exploding, what do we need to talk about competencies for? Well, what are competencies in the first place? Well, the AAMC, the American Association of Medical Colleges, defines competencies as observable ability of a health professional related to a specific activity that integrates knowledge, skills, values, and attitudes. I mean, basically, what does a physician progressing towards attainment of expertise do, know, and value as it relates to telehealth? Well, traditionally, we've looked at teaching, training, etc., sort of in the mode there on the left. You go to a lecture hall, you learn what you got to learn, go out and put it in practice. A number of years ago, competency-based education became very popular in the way that most medical schools operate. It's putting people in the field, basically, getting them out there, getting them to work with other physicians to figure out and serve as an on-site, in situ, education-based experience. So a lot of what we're after and how we're training our trainees today is through competency-based education. The framework for that is basically, identify what the content should be. What do you want your trainees to learn? Determine what the targets are for developmental progress. What do you want them to achieve and to what degree? You want to focus on outcomes as well as standardization. But you also got to allow for flexibility. I mean, every medical school cannot train students in the exact same way. There's different teachers, there's different settings, there's different patient populations. So it's got to be flexible as well as, focused on standards and outcomes in terms of the actual implementation, the time course of that implementation and what skills they gain and when, as well as the path for achieving these goals. Now, this is just a nice diagram that the REL Southeast measurement program put out. And it basically is a nice framework, and it kind of shows it's all about structure, it's about culture, it's about teaching, and it's about learning. It's not one of these, it's all of these. It's a framework, and you've really got to concentrate on all of these different aspects. And the part that I like is that it focuses on learning, that the students have to have a voice in this process as well, in terms of not only, what do the trainers expect of the students, but what do the trainees expect of the experience as well? And how can all of this work together to create competent providers once they graduate and go out and into practice in the world. And again, this is not just medical schools. This is MDs, DOs, RNs, the whole nursing profession. This is uh, physical therapists, occupational therapists, speech language therapists, counselors, MSWs, and so on. I also like the second column there on culture. I think culture is incredibly important to keep in context when you're teaching and training folks in the delivery of healthcare. Now, some ways to achieve competency, to achieve this competency-based framework. Well, develop stakeholder relationships and assess their readiness and their to face challenges and barriers and what those challenges and barriers are. Get formal commitments to engage in a new way of teaching and training. Adapt and tailor content to the particular context of your local situation. Provide assistance as much as possible to those who are organizing, those who are doing the training and the teaching, and to the students. Disseminate the content, get it out there, not only within your institution, but beyond your institution. Actively engage patients and their families in their process, their feedback as to what they expect in terms of competencies, especially in the telehealth arena. Again, most patients are willing to do telehealth, but they want to know either from their friends or from the star ratings that telehealth works and that whoever's doing it gets that 5-star rating, speaks to the competencies. Develop financial strategies and promote infrastructure changes, for example, like credentialing and accreditation. These are just all different things you might have to pay attention to. Now, there actually are a lot of people working on telehealth competencies. I was privileged recently to be part of a task force through the AAMC, specifically on the development of telehealth competencies. And this is a document that's pretty much in its final stages. It is out there and available. If you need a copy, I can show you the link. And it created domains of competencies for telehealth. And how it laid it out was for those who are entering their residency. This is for medicals. This is AAMC. So this is for medical residency. So those entering residencies, recent medical school graduates, these are the competencies you would expect them to have by the time they graduate. Those who are entering practice, so recent graduate, and more experienced physicians. It's nice that they look at competencies not at a single point in time. It's a continuum. There are a lot of providers out there in their 50s, 60s, 70s who have been providing traditional healthcare for years. They have to also consider what their telehealth competencies are. So they're here on the far right side, even beyond these 3 to 5 years out. Now, the AAMC, we and this group, this expert task force, looked at and developed what we considered, based on experience, expertise, and so on, a core set of domains. The first one kind of makes sense: patient safety and the appropriate use of telehealth. And we created within that 4 different categories. And I'm not going to go through all of these again. I can provide you the link to the document. But it really looks at how do we make telehealth, telemedicine, a safe and effective way of interacting with our patients. And the key thing about the AAMC competencies, it expects different levels of incorporation of these competencies depending on what stage you're at. So again, the first one is patient safety and appropriate use. The second one has to do with data collection and assessment via telehealth. I mean, how do you do a virtual physical exam? You can't touch the patient. You can't smell, for example, the alcohol on their breath. You can hear things, you're talking with them, but you can't hear all the subtleties. You can see them, obviously, but it's a 2-dimensional picture of them if you're watching them on video. So how do you collect data in an efficient and effective way that's going to give you enough information to render a diagnostic decision? So that's one of the competency domains. The third domain is communication via telehealth. How do you communicate with your patient? What do you need to be able to conduct a visit using virtual real-time conferencing? How do you communicate with your patient if you're simply communicating via email through the patient portal? You need different skills to communicate via video and writing than you would with the person just sitting there in your office. You can't deliver bad news to a patient by texting them or emailing them. Your latest results show you have cancer. Sorry, get back to me, happy face emoji. You can't do that. Yet you'd be surprised what people do. So we said people have to have adequate competency in their communication skills via telemedicine. The fourth domain is ethical practice and legal requirements for telehealth. We're not expecting people to become lawyers. We're not expecting them to become policy wonks. But what we are expecting is that people have some basic understanding of how telehealth differs from in-person practice, what the legal and ethical ramifications of that are, and how to keep up and then be able to communicate to people once you become a practicing physician, what those ethical and legal requirements are. The fifth domain is technology for telehealth. We expect providers to have some degree of competency. Again, you don't need a PhD in health informatics. You don't need to be an IT person, but you do need to be able to have some working skills with the technology of telehealth, because you are the frontline person using it. You have to know where to look in case something goes down. You need to be able to troubleshoot on your own to help a patient work through some of their technical problems. So again, a little bit on the technology side. And the last one is domain 6, access and equity in telehealth. To some extent, telehealth provides access to a lot of different populations that didn't have access to healthcare before because of geographical distances, perhaps, or other concerns. However, being a technology-based modality, it presents its own equity challenges. Not everyone has access to technology. Not everyone has access to broadband or good connections. So how do you connect via telehealth to a patient who doesn't have an internet connection in their house? What are the limitations? And how can we improve access and equity to care using telemedicine as opposed to traditional care? So again, we expect people to have some awareness and competency in this domain as well. Now, there is a growing literature of recommendations and possible frameworks. The AAMC is not the only one that's out there. Most are being developed for MDs, but there's a lot in the allied health area as well. I know a really good nursing competency program that someone developed. A lot of the literature out there, there's some reports on implementation, but to be perfectly honestly, not that much. Usually they're on short courses, medical school electives, or short term, 1 semester or less. There's not a lot of literature out there on programs that implement competency-based training in their entire length of the training program for a healthcare professional. And most of these reports in the literature report on class evaluations, how good with the professors, how did you like the course? Some of them had test or skills performance assessment, but really not that many. There's very little real life or long-term assessment of telehealth competencies in folks who have been trained in telehealth. What's much more common out there than formal competencies integrated into our training programs are online courses or training for practitioners. There's a lot of really great, 2, 3, 4-hour courses out there. There's a lot of CE, CME, CPD being offered at society meetings and so on for courses or sessions developed or dedicated to telehealth. There are some certificate programs. Most of these are certificate of attendance, attend my online course or attend my webinar, and we'll give you a certificate of attendance. It's not true certification, which is very different. Some places do claim certification, but certification has a very special meaning, especially in healthcare, and most do not really offer true certification. Some are best practices, sort of a how to use our technology, how to use this platform. Some charge and some are free. So there's just a lot out there in terms of basically training and education on how to do telemedicine, what it's all about. But again, there's not that much in terms of true integration of telehealth competencies into a training curriculum. This is another approach to competencies that I really like. This is Don Hilty from UC Davis. He's a psychiatrist, and he's been working on developing telehealth competencies specifically for behavioral health. But I think they kind of apply across the board. What you learn for telebehavioral health can really be applied anywhere. This is an interesting article that he wrote that compares a variety of competencies and guidelines from various institutions. He looks at the psychology, looking at Canadian and US combined, social work, marriage and family therapy, psychiatry, the American Telemedicine Association, CTIBS, TBH competencies, and so on, and looks at, what do they cover? Patient care, communication, systems-based practice, and so on, and then simply checks off how well each one of these meets those criteria. And I think analyses like this are very important. One, again, to see what's out there, see what people are doing, and then see perhaps how we can take all these different proposals or frameworks for assessing telemedicine competencies and create perhaps a single unified set of competencies that we could all use. Don has also created a couple nice frameworks that really show sort of the magnitude of what we're considering in telemedicine competencies. He has a couple of them, one here for mobile health and phone apps, and then another one for mobile health as well. And he developed these, and each one shows sort of, we want competencies, and it's well enough to say, we want competencies, but there's so many different areas, learning and teaching environment, teamwork, collaboration, the technology, pre-existing technologies, and how it really encompasses the caregivers, the community and public life, the home, all the different environments. So I like these two diagrams because it really shows that it's not just thinking about how can we put it into our schools and our training. We have to broaden our perspective and really create a framework that encompasses the totality of what telemedicine and education really is all about. Now, there's some common themes that I've seen in the literature regarding competencies. Most of them cover things like technical, privacy and security, all cover that. Most of them cover history taking, clinical skills, patient assessment, how to do an exam, basically. Communication, professionalism, rapport, cultural aspects, they all cover that. Legal, ethics, informed consent, financial documentation, how do you get paid? Benefits and limitations, how to create a good environment, managing operations, emergencies, what do you do if the patient has, a heart attack or something while you're doing a telemedicine encounter? Who do you call? What do you do? And a lot of them are specialty specific. There are, however, still some gaps. Most of these competencies have to do with video conferencing. There's really not a lot out there on store and forward competencies, mHealth, eHealth, or remote patient monitoring competencies. And these are areas that are exploding in telehealth. So again, our trainees and those providing telemedicine really need to develop some competencies in these areas as well, not just the talk modalities. We also need metrics. How do we gauge whether or not we're successful in instilling these competencies in our trainees? I think they also need to be interprofessional. It's not just MDs and DOs. It's the collaboration, the teamwork. Telehealth really enables team practice and giving patients access to all sorts of providers. So I think our telemedicine competencies have to be interprofessionally based as well. We need some uniformity and consistency in our terminology. There's just a lot out there, like I said, telehealth, telemedicine, virtual care. It's just, there's so much. We need some uniformity. And we also need a way to rank the level of importance of some of these terms and some of these ways of interacting with patients. And we need to recognize that there's differences in the types of competencies that we would expect from our providers, depending on where they are in the training curriculum or in their stage of providing care. So in summary, I think it's clear patients and providers want telehealth, at least to some degree, and it's increased as a function of COVID. We'll see what happens afterwards. There's lots of players in the field, but not a lot of standardization in terms of developing competencies or in terms of how people are providing telemedicine care. Trainees are seeing telehealth more and more as a function of their training. And some institutions are preparing them to some degree, but efforts really are not organized across the country or across the world. And there's not a lot of standardization. Focusing on and promoting core competencies is fundamental, in my opinion, to achieving effective, efficient, and safe use of telemedicine. Likely, I think we need a broad umbrella, for example, like the AAMC competencies, and possibly then specialty-based supplemental competencies like the ones that Don Hilty is developing for behavioral health. So I think, again, it's a field that's incredibly important and is going to become increasingly important as we come out of COVID and people realize even more the importance of telemedicine. So thank you very much, and I hope to be able to answer questions during the Q&A session. But if you do have any questions or need some of the materials that I've been talking about, please just feel free to contact me.